Welcome to 50 Shades of Midlife. It's brought to you by Jean Hales for Women's Health. I'm Dr. Sally Cockburn. I'm a GP, but tonight I'm your host. Now, for those of you who don't know Jean Hales, it's a leading national not-for-profit organisation that combines research, education and clinical care for women. This webcast is a result of Jean Hales' research into women's health information. And it's about your needs, and it's also about health professionals across Australia. So we'll be covering what you really want to hear. You asked it, so here it is. And of course, we've got a fabulous panel of guests, and I'd like to introduce you to them right now. First of all, we have up here the magnificent Dr. Liz Farrell. You're very welcome. She's a gynaecologist and founding member of Jean Hales. She's passionate about helping women effectively manage midlife and the menopause. Next to her is the wonderful Sandra Villella. She's a naturopath and herbalist at Jean Hales, and she specialises in the menopause. She's keen to bridge the gap between natural therapies and conventional medicine. And next to her is fabulously wonderful, I'm going to run out of superlatives here shortly, Professor Jane Fisher. She's a clinical psychologist and the Jean Hales Professor of Women's Health at Monash University. Her aim is that she wants to help women better understand and protect their mental health. And next to me is a stupendously fabulous, Maureen Matthews, and she's a sex educator who runs workshops as well as an adult shop for women. Known her for years, she's a fabulous woman. And she also runs it for couples as well. She also writes a weekly column in Melbourne's Sunday Age where she answers questions about sex and relationships. Okay, I have some housekeeping, as you do. You know, we're all loving to be the housekeeper, and I think I better cover some of them for you. So, now this is a live event, so that means there's no pause button, so you can't stop and rewind. However, it will become available over the next month on the Jean Hales website if you missed something. So in the chat window on your right-hand side, that's where you can type your questions. Unfortunately, we probably won't be able to answer them all, but we'll have a good go. So we can address you. Please, can you include your name and where you live with your question? You don't need to put your full name, and I will protect your anonymity. But we will be answering your questions throughout the discussion, and when we can do that, we will. Then we'll also have some time set aside for questions at the end. Can I just put at this point, we'd love to hear from you blokes as well, because we know you suffer from menopause as well. I know, because you have to live with us. But it's great to have you here as well, and we know there is a lot of you in the comfort of your own in your own home watching right now. So please, though, try to keep your questions general, because the experts won't be able to provide you with individual medical advice. And if I can just say that the webcast is designed to be informative and educational, but it's really not intended to be specific medical advice or replace the advice of your health practitioner. Now, we have an audience tonight in all states and territories, as well as, yes, overseas. And there's more than 1,500 people who've registered and 80 community groups who are hosting webcast events in your own town. So I'm waving at you right now. Please wave back. And that's probably an audience of more than 4,000 people. So I think we rate more than home and away. Oh, no. Anyway, you'll see a map on your screen very shortly, and there'll be yellow dots. Now, that's where our viewers are watching from, and the blue dots are where the group events are located. So, having said that, it's time to get on with the show, so to speak. And Liz, I think I'll start with you. And let's start with something really basic but very important. How do we define menopause?
Menopause is the final menstrual period. That's it.
Okay. So but everyone says, I don't know when I've had my last one because another one came in sort of 6 months later.
If you haven't had any bleeding for 12 months, then you've had your final menstrual period. And medically, that's the definition of the menopause. But we know it's used in such a social way. You know, I'm going through the menopause, but in fact you've gone through the menopause if your periods have stopped. Or, you know, it's the menopause. Well, what does that mean?
Well, what's perimenopause then?
Now, perimenopause is the time before the periods stop. And it signifies, it commences when women start to have irregular periods.
Is it only about irregular periods? Can you have like flushes and stuff like that?
You can have all those symptoms. So you can have hot flushes, sweats, feeling moody, feeling all over the place, really. I mean, that's one of the things that the women will say, that they really don't cope as well. And it's because the hormones are sort of going up and down all over the place. And I think it's a time in which women do have a sense that they're not, you know, they can't cope with what they used to cope with.
So not coping is a reasonable sort of thing to think, well, that might be part of the cluster?
Yes, and it usually goes on, from some of the research, it goes on for about 4 to 6 years on an average.
Before you have your last period?
Before you have your final period. Yeah.
So that's what the whole thing. Some women say, though, that when you have your last period, is that when it ends? It's like when you end your flushes?
No, well, that's the problem, isn't it? You know, because symptoms can go on for some women just have their final period and that's it. Some women will have really bad symptoms like flushes, sweats, aches and pains, and that can go on for many years. About 10% of women will have symptoms that go on for more than 10 years. Most women will have symptoms that go for just a few years. However, some of the research from Melbourne shows that the sort of mean time is about 8 years.
So do women need to treat these symptoms? I mean, I think there's a lot of women saying, you know, should I do treatment of any description? Should I do anything about it?
Well, it depends on how much the symptoms are impacting on their life. And it's about the intensity of the symptoms and the quality of life that they're experiencing. I mean, if you're having a flush or a sweat or whatever every half an hour or every hour or every 2 or 3 hours at night, and you're waking up struggling to go back to sleep, or you're in the perimenopause and you might feel a bit hot, but it might be a cycle where in fact you've got really bad PMS and you're waking up at night and you don't know why, and your quality of life is impacted upon where you can't function properly, then that's the woman who needs to be treated.
I'm going to come back to that because, Jane, at this point I just wanted to bring you in, because a lot of women say it's not the flushes that really worry me, it's my coping mechanisms. And I mean, you know, this is obviously, people sort of say, well, how do I know it's menopause or whether it's me not coping?
Well, I think I have a slightly different view from Liz, actually,
and you're allowed.
About women's capabilities in midlife. Because interestingly, one of the phases of life when women are least likely to experience depression is in midlife. And I think it's because by then most women have experienced a lot. They've reached an understanding that good times come and bad times generally pass. And so in general in midlife, women have developed some better mechanisms than they had earlier in life. But nevertheless, they're having to manage, as Liz says, this physiological change, and it often coincides with major change in other aspects of their lives. And sometimes those can be unfamiliar, the sense that their children are growing and leaving home and they're having to think about what they're going to do now to give life meaning and value.
So is it reasonable to think, hey, there may be a few things going on right now, I need to tease it out?
Well, I think it's a time in which women say they're not coping as well because, in fact, there are many more life stresses as well as the physiological hormonal changes which are taking place. So you talk about the children leaving home, however, they come back. So we've got the
That's
boomerang.
Always a stress, really, when they come. Why do they come back?
So it's it can be that.
Yes.
It can be that women are reaching their career peaks.
Exactly.
Around the age of menopause, and they've really got to function at a much higher level. Or their partner is in fact retiring or has been made redundant, or you know they lost all their superannuation in the GFC. All those things impact upon experience.
So can I ask you then, Liz, when it comes to, I mean, some women are going to have symptoms, some women are. We got any sort of figures around the percentages of women who are going to get symptoms?
Well, about 20% of women will just have the final period. That's it.
Oh, lucky girls.
Lucky girls, I agree. About 20% of women will really struggle with the symptoms and they will really impact on their quality of life. But the majority of us will have some symptoms, but in fact, we may or may not feel that we need to have treatment. So some women will have really bad flushes and sweats and things, and you know they'll just peel off the clothes.
So there's no mandate that you have to do anything about it. There's no but equally, if you feel you're not coping, is there any reason not to?
If you feel you're not coping, the answer is it depends on your risk factors. So if you're a fit, healthy woman between 45 and the late 50s, and you've had your final period and you're really struggling with the symptoms, then hormone therapy would be the treatment for you because in fact if a woman's got severe symptoms, that's the only thing that's going to work. But if they're in the other group where they've got mild to moderate, then they may try other things.
Can we bust a few myths? Because I've had you and Henry Berger on my radio program. There has been, let's face it, swings and roundabouts over the last 10 to 15 years on, is HRT safe? No, it's evil. No, it's good. No, it's everything. What's the current sort of thinking on HRT and whether it's safe for women who do want it, who do need it?
Well, what I've just said, that in women who are low risk for heart disease, stroke, high blood pressure, clotting problems like DVTs, etc., if they're low risk for all of those factors, then going on to hormone therapy is very safe. In fact, we still believe that the previous data before the Women's Health Initiative study 10 years ago was that cardiovascular disease was protected. And it looks like that in those women between 50 and 59 in the WHI study, that is actually correct.
And how long should a woman stay on HRT if she goes on it?
Well, my belief is as long as she needs it.
And how does she know? Can she go, just stop it?
Well, she wouldn't stop it. She might reduce the dose down and see whether or not she's still got symptoms. Or she might cut it out for a period of time and see whether the symptoms come back. The problem with that is that then often if they are going to come back, you then struggle to get them back under control again. So it's better just to reduce the dose.
Just one thing, I'm probably going to preempt something that someone wants to ask, but when we used to say, oh, you need to wean off them, women want to know, am I going to have to go through the menopause all over again when I go off them?
No, the issue about that is that if your finite time for flushes is, say, 5 years, and you stay on your therapy for 6 and you go off it, then you shouldn't have any flushes. Now, some women have a few rebound flushing, but after a number of weeks that will settle down. But the majority, if you're going to have symptoms for 10 years and you go off at 6 years, then you're still going to have the flushes.
Now, I need to ask you, because it's a good segue into Sandra, and that is bioidenticals, other stuff. I mean, should women try natural therapy first, bioidenticals first? What should they do?
Well, bioidentical hormones are those hormones that are prescribed by a group of doctors, and the prescription is made up by a compounding pharmacy. And in principle, it's just another form of HRT, but it's not how it's marketed. And it's marketed supposedly as being safer than what we would generally, what are in fact approved of products, whereas these bioidentical are not approved in Canberra. But in principle, they are exactly the same as any form of HRT. And if you lump every form of HRT into one basket, then you have to say that the risks are the same.
Can I ask you on that? A lot of patients or women have told me that they have been asked to have a blood test to see if they're on the right dose.
Well, there's no such thing as the right dose. The right dose, in fact, is what treats your symptoms. So, for example, I had a woman recently who had really bad leg pains, and on a certain dose, very low dose, took the pains away, and that was the dose that she was comfortable with. I have no idea what her blood level is.
It's and so it doesn't matter?
It doesn't matter. It's a waste of money and blood. But I think talking about hormone therapy, one group of women that in whom it is essential, if they have no major risks, is those women who go through menopause early. So those women who go through...
What's early?
A premature menopause is before the age of 40, and an early menopause is before the age of 45. So those women are at much greater risk of developing heart disease and osteoporosis at an earlier age.
And is there any problem? I mean, if they were to stay on the hormones till they were 50, let's say, when it's just the classic, when you should go off it, are they at more risk, the same risk? Is it the same for another 50-year-old? If you get what I'm saying?
What we don't know, and we'll never know, is that there'll be no studies like the WHI done on women who go through early menopause. So what we are saying is that the risks of a 50-year-old, regardless of what their previous experience is, should be about the same. But women who've had their ovaries out at the time of either a hysterectomy or they've had their ovaries out for some other reason, then they're going to have worse symptoms, and they may need to stay on it over 50.
Sure. I'd like to move on to you, Sandra. You're a naturopath, and I mean, you're sitting here amongst, so you've got a gynaecologist there, you've got a GP here, but we're your friend.
Yes.
And I mean, this is the whole thing. Are we moving closer together in that respect?
I think there's still very much individual relationships that are being bridged between the groups, and I think that has to do with many factors, and mainly because within natural therapies it's quite an umbrella and there's quite a diversity in practitioners. So unfortunately in this country it's an unregulated profession, so somebody up the road could put up a shingle and start practicing as a naturopath tomorrow and there's no law against it. Now they can come across as being very convincing and give you all this information, and then there are others who have worked pretty hard to get where they are and have built relationships with other health practitioners.
So how could someone watching now discern who is the naturopath that has got the bona fide, shall we say?
We do have professional associations, and the professional associations, you do need to have a certain level of education to be part of those associations. So we'll have those associations up on our website. So things like the National Herbalist Association or Australian Natural Therapists Association. That's a good go-to step to find a practitioner.
What is this? There is middle ground, and I think I'll ask you the question, what is the middle ground? Because I know the answer, but I want to ask you because I think it's good. That with the, like people say there's Western medicine and there's naturopathy, but what is the middle ground?
I think the true word of complementary probably describes that. Complementary meaning that certain types of medicine or certain types of therapies can complement each other. So for example, I very much would have a patient who is taking hormone therapy, but she may come and see me because she wants some moods managed.
So you're not saying get off that pharmaceutical stuff?
I don't, no, and it's not our job to say that, and I think it's irresponsible to do that. If a woman wants to come off her hormone therapy, she needs to do that through the proper.
So I'm just worried there's a lot of women who are thinking, I can't tell my GP that I'm taking this because they're prescribing that, and I worry about that. It's not about us, it's about them.
I actually think it's a really good idea. First of all, it's important because there are interactions, but I think it also, what I find is when patients talk to their GP or their other health professionals about what they're doing, it actually educates that other health practitioner, and you often get that health practitioner contacting you to find out, and that's where the bridge.
But very often you'll get someone come in and they say, I've been to my naturopath, and they've been prescribed this herbal remedy, and you say, what's in it? What's it for? And they go, I don't know.
And so should we be able to ring the naturopath and ask them what's
what
in
the active content is?
But you know, because you would tell me what was in your, if you wrote me a letter and you'd tell me what was in it. But most of the women don't. And I say to them, but if I prescribe the same product, you'd expect me to tell you the hot flushes and all the, all the side effects, and is it going to give me hot flushes and sweats, or is it going to do this, or is it going to do that?
So you know what I was aiming for? The middle ground is evidence, is it not?
I think so.
Look, that's a good question, and there are different levels of evidence. In scientific circles, the gold standard is the clinical trial and meta-analysis, and that's great, and there is evidence building of that sort around natural therapies, but there are other sorts of levels of evidence, like traditional evidence. So we can't say that we have
5,000 years of Chinese history can't be all wrong, I know.
Well, with some things, yes.
Exactly. No.
So that level of evidence where you've got traditional levels of evidence.
We've got a question from Karen, and Karen asks, is black cohosh safe to take for the long term? And she doesn't actually say what long term is, so maybe you can give us some idea.
Well, there's two parts of that. First of all, black cohosh is a herb that's the one herb that has had the most research done on it in terms of natural therapies. And in terms of taking it long term, like Liz, basically you take something as long as you need it. So there's no
and can they
reason.
Be 80? Because a lot of women say to me they're 70 and 80. I don't want to go off this stuff.
Yes, but because black cohosh, the most common reason a woman would take it would be, say, for hot flushes. If she's no longer experiencing hot flushes, then she doesn't keep taking it. It doesn't add any protective benefit for anything else.
But so have a trial off it, go back on it if you need
to.
But
safety, the issue around safety is that black cohosh has been shown to be caused liver toxicity in very rare circumstances.
In which case, see your GP, have your liver
tested?
See your
GP, yes. It's not like it's a liver toxic herb. There are some herbs that are liver toxic. It's a rare complication. It's like an idiosyncratic, unusual allergic reaction. And the TGA, which is the governing body of medicines in Australia, have a warning on there that says it is so rare that it's, given its widespread use, it's still safe to use.
Now the other one obviously that people often talk about is phytoestrogens. Now what's the role for phytoestrogens?
Okay. Phytoestrogens, which are plant estrogens, they are useful in many factors. The main reason women will be using it to try and get some relief of symptoms, but not all women will. And it's got a lot to do with how we metabolise or break down these phytoestrogens. So we think about 1/3, possibly up to half of women will experience some relief of phytoestrogens from having real foods.
So where do you get it from?
Yes, real foods like soy, not some soy supplements. We don't know the evidence with soy supplements. We can't say that that is safe, but basically things like whole bean soy milk, and again there are different types of soy milk, whole bean soy milk, soybeans, tofu, tempeh, cooking with soy flour, for example.
A bit off the topic, but I need to ask because I know the blokes are watching. So the blokes are thinking, hang on, if this soy stuff is helping the menopause, what's it doing to me?
A lot of misconceptions about phytoestrogens because they think that it's estrogen, it'll cause breast cancer, it'll lower testosterone. There's no evidence to show it lowers testosterone, and in fact it's quite useful for men. It can actually help with decreasing risk of prostate cancer, and the protein in the soy actually helps to lower the bad cholesterol, the LDL cholesterol. So it's good for all.
I've got a question from Sonia from New South Wales. Does exercise help relieve symptoms?
Is that for me or is that for you?
Everybody.
Well, it's a tricky question actually, because I think the data's fairly mixed. It's a bit difficult.
You know, I'm going to put my general practice hat on here and say it can't hurt, Sonia.
It can't hurt, but I think that
well, can we say though, now here's maybe where she's coming from. Can exercise help symptoms? If your symptom may be mental health symptoms, we know that of course exercise will raise your happy hormones in your head.
And also sleep. It does help sleep, and particularly Tai Chi and yoga, but quite regularly.
But if you look at hot flushes, if you go out there and do high impact exercise, it'll make them worse. There's a little bit of data that suggests it may, but not necessarily. If it's moderate exercise, it may help you, but it may help hot flushes and sweats, but exactly, it's going to help mood and it's going to help you sleep.
General health.
And general health.
And general, cardiovascular health, all that.
Sandra, sleep, we've all said sleep's important. Are there herbal remedies that can help with that aspect of things?
There is. We were discussing before, Jane and I, that the difficulty of midlife sleep problems is probably beyond just hormones. And the difficulty, one of the most challenging things is managing that waking through the night. And so recently there's been a couple of very small Iranian studies which have looked at a couple of common herbs like valerian and passion flower. But also you can't go past the fact that, you know, you've got to look at sleep hygiene, you know, alcohol, for example, not drinking alcohol before bed particularly, but, you know, that can be a trigger. It's a tricky one. And of course, you know, things like taking your calcium at night may help, but all of these things might help, but it can be quite tricky to manage.
What about, I suppose, 5 naturopathic tips?
I thought about this. Now I wanted to make them really easy, not these sort of fancy you have to go out and source them. So my 5 foods for midlife are, of course, there has to be sardines. Yes. So sardines, good old cheap sardines, because they're a really excellent source of calcium. They're rich in omega-3 fatty acids, which is good for our heart health and our cognition, and they're a sustainable source. And the second one, these are in no order of importance, prunes. Good old prunes. Prunes are having a comeback. Everyone thinks blueberries are the antioxidant, but prunes are very high in antioxidants. And there's a recent study that showed that they may actually improve our bone density. Take it now. That's about 10 a day. Now that might be a little bit more than some women's bowel can tolerate. But prunes, get back on the prunes, and also linseeds. Now linseeds, 2 dessert spoons of freshly ground linseeds is a great remedy.
Preferably not all together in a mix.
No, well, you're thinking, well, maybe not the sardines, but otherwise you can be looking at breakfast. And the linseeds can help with vaginal dryness. Broccoli is my vegetable of choice because it's a good one. Women and men who eat broccoli and that family regularly, that's associated with a decreased risk in certain cancers, including breast cancer. And my final one, I've got to remember what it was now, linseeds, prunes, sardines.
Tuna?
She's not having a menopausal moment.
I'm having a low estrogen symptom moment. Can I come back to that?
While you're thinking about that, I'm going to come back to you, Liz, and just ask you, because we didn't cover it in your bit when we just spoke, is breast cancer. I mean, let's face it, the whole thing around HRT was, oh my God, HRT causes breast cancer. What in short is... Thank you.
But in women who have breast cancer and have severe menopausal symptoms, aches and pains, hot flushes and sweats, those major ones, then we have to look at non-hormonal prescriptive therapies.
What about sisters of women with breast cancer?
Well, their main risk is really their sister. And so it really depends on their the individual circumstances around it. I don't stop women from, or I don't recommend that they don't take hormone therapy, but they need to be monitored carefully, and they're obviously going to be monitored for breast cancer anyway.
I
Have you thought of your
remembered,
fifth one?
Low-fat yogurt.
Low-fat
Low-fat
How
yogurt,
could we forget
unsweetened, because a good source of calcium. It helps with the way we metabolise our estrogen, and it's a good source of protein.
And very nice with prune juice.
And very good,
Oh,
very
there
nice
you
with
go.
prunes and linseed.
Bit
You
of
can see where I'm
Birkin,
going.
usually
Yes.
and I do, before we move on to Joan, because we must move on to Joan, I want to ask you about the acupuncture and the role of acupuncture
Yes.
in the study.
Okay, acupuncture is another form of treatment that might help with some women, and there is currently a study that's going on, and the details are available on our website. It's called Acupause, and women not only in Melbourne but regional Victoria, I think Queensland, and also in some parts of New South Wales can actually have access to this, so you can get the details from our website.
Did you notice, by the way, in the intro how I said you can't pause?
You can
You can. And it's not trick or treat. This is no trick or treat. No, you're not allowed to talk because I'm going on to Jane. Sorry. Oh, God, I'm tough. Oh, okay, go on. What did you want to
I
say?
just wanted to mention also mindfulness therapy,
Yes.
and maybe you would comment about that as well.
Well,
as
we
a
can
form
start
of
with that.
treatment.
Tell us about mindfulness.
Well, mindfulness is becoming a very popular approach to self-management, as well as use in therapy. And it's really encouraging people to think about their mood and their state, and to encourage people to create moments of stillness in their life, where they're conscious of slowing down, trying to stop racing thoughts, trying to just be still and not get agitated and worried. And the evidence seems to be that it is a helpful approach for those who in particular are experiencing being agitated and overactive.
We've got a question that I think involves several of us, really, and that is from Diana from Newcastle. She says she suffers with clinical depression. Her doctors doubled her medication, which made her more tolerant of life. She'd love to be able to hear our thoughts on the ability to cope with life in general, which I think is what you're really talking about. But I think the thing, Diana, that's very interesting is that you're talking about taking medication and being okay with it. And I think the worry we've got is a lot of women who say, I just want to soldier on. And I'm very worried about them.
Look, I think there's no doubt that some people experience great benefit from antidepressant medication. Many people prefer not to use medication, and we shouldn't really be positioning these as opposing or competitive positions. But I think even with antidepressant medication, if you're experiencing a persistent low mood, a sense of pessimism and hopelessness, it's very important to think about your circumstance, because depression does not occur in a vacuum. Depression occurs in a life context, and almost invariably it's reflecting your circumstances. And it might not be in a way that's very obvious or easy to understand, but the two hallmarks of experiences that contribute to feeling depressed are if you feel trapped in a situation and you just cannot see what the path forward is, and if coupled with that you experience humiliation. And I think it can be very beneficial to really think about what in my life is making me feel like that, and what, if anything, can I begin to do to address these problems. If you really are experiencing depression, it's important to have those conversations with a professional person, but it doesn't have to be limited to a health professional. And many people manage variation in their emotional experiences actually through conversations with the people they love, the people near them, with their friends, with their colleagues, and use that as a mechanism of solving things that at the time seem extraordinarily difficult to live with or manage.
A question from Wave, and I think this probably involves all of you, which is, and I'll start with you though, Jane, an effective remedy for mood swings.
I always wonder what people mean when they talk about mood swings, and probably it's a thing
Well, is
that...
it normal to have mood swings or mood changes?
Yes, emotional variation is absolutely normal. We need to experience variation in the emotional texture of our lives all the time, every day. What's very important though, I think, is to be thoughtful about it. Is my variation in mood actually causing me problems? Is it causing me problems in my relationships with others? Sometimes when women use that term, what they really mean is they're feeling very irritable, and they use this as a descriptor for irritable experiences and irritable behaviours. And there's no doubt that irritability is like rust or corrosion in an intimate relationship, and there is no doubt that some women report an increase in irritability in midlife, that might have a hormonal underpinning. And I think if you're experiencing really persistent irritability with things that at other times you might be able to laugh about or ignore, then it is probably important to have some questioning about why is this happening, what is it that I might do about it, and how might I manage this differently.
I think Wendy from Victoria's got a very interesting question, and it's comment and question, I think, which is what about increasing irrational anxiety? That is, nothing's going wrong in my life, I'm just feeling really anxious.
And again, very good that she can identify and name it. And anxiety is very uncomfortable. None of us like feeling anxious, and it is undoubtedly something that can vary across the life course. Again, anxiety almost invariably reflects something going on around us. And
but
usually
she's saying it's irrational. She's saying I don't have anything going. And I've got to say, I see these women who say there is nothing going on in my life. All of a sudden, I'm just feeling really anxious. Now, it happens around menopause. And so can menopause, and I don't know if any of you want to answer this, can menopause cause you to have a change in your brain chemistry to cause these sort of things?
Liz might be the best person to answer that.
I think that we see this very much in the perimenopause. Now, we know that in the perimenopause, the hormone range can be extremely wide, and research from Sydney has shown that some cycles in the sort of mid-perimenopause to late perimenopause, we can actually ovulate twice in a cycle, one of which can be during a period. So there's where...
Watch out, girls.
Watch out, girls. Contraception's important.
Well, that's something we haven't covered, which is the need for contraception during this time.
And so in some women, there is an increase in PMS. So because there are these dramatic changes in hormone levels.
I think that's really, really valid, and I think a lot of women say to me, you know, after they say, how come I never really had PMS? It seems to be getting worse in my late 40s.
And I think that's true, and whatever the cause of the onset, and I think sometimes it is the perimenopause, but there'll be some people who have PMS a little bit, and then after children, you know, we often see there's a trigger. You get, you know, as women are going into their, after they've had their kids, early 40s, etc., there's a slight increase. Now, why that happens before the perimenopause started, I'm not sure, but in the perimenopause, those women can have really bad symptoms, including this irrational...
So can I ask then, maybe, and Sandra, maybe this is for you, during that time, when we have women who are cycling and they've got PMS, we suggest vitamins, you know, B1, B6, those sort of things. Will the natural therapies, such as vitamins, such as some of the other evening primrose oil, help these women in this perimenopausal time?
It may do. Again, it's really important to work out where it's coming from. So if it is perimenopausal PMS and treating it with a B complex, not just the B1 and the B6, but the B complex might be useful. There are herbs. Now, I'm cautious about answering this because we don't want to encourage self-prescribing, but herbalists would use a herb called Vitex agnus castus or chaste tree.
As they do.
As they do. And there's a pilot study of the British Medical Journal that shows that it is effective for PMS. And
so repeat what it is again.
It's Vitex agnus castus or chaste tree.
Chaste tree.
Yes. And in fact, my emails, at the top of my emails today, but I'm so time poor I didn't read it, actually said new evidence confirming that it is the best treatment for PMS, and I didn't think we'd be needing to talk about it today, so I might have to do a follow-up on that.
There's also been some research looking at the use of calcium and magnesium.
Yes.
Would you
Yes,
comment
absolutely, calcium and magnesium. Magnesium, naturopaths have always thought about magnesium using it, but now having that in decent doses as well.
But I do need to add that it's relaxation is a very important thing.
Meditation works.
Meditation works, deep breathing, slow breathing works.
Going to the zoo.
Distraction works. Trying very hard to problem solve rather than catastrophize works. I think together they would be important.
Which is really hard at the time of your life when everything else is going haywire. And I mean, that's the thing. I want to move on because we haven't spoken to Maureen, and let's face it, everyone's waiting for the sex. Well, actually, now that's an interesting point. What about menopause? The majority of women come and say to me, oh, look, you know, Sally, I'd like to have that rampant sex life that I had, but frankly I prefer a cup of tea. I mean, what can they do to feel better?
Well, I think the first thing to be said is that a decline in, well, the quality of the sex life you have after menopause is very much linked to the quality of life that you had before menopause. So if you have been sleeping in separate beds for 20 years and then you go through menopause, you're not going to be swinging from the chandelier. So, you know, what you're trying to do is to maintain probably something that you've been comfortable with and used to. We must remember as well that the men are part of the equation here, because, you know, there's a myth that, postmenopausal women lose their libido and go off sex. But men as they age have issues of their own too, including erectile dysfunction, and these can impact on the relationship and the stress in the sex life. So it's not just a one-way system that's, you know, the women have the problem.
And if I can say though, at that point, not everybody is heterosexual.
Exactly.
And not everybody is in a relationship. So I suppose we need to sort of look at...
Exactly. And
two menopausal women together would be interesting.
Would be fun.
Oh, that would be good. Write to us, tell us. We want to
But one of the things that is another myth is that women after menopause lose their libido, and that's something I really want to challenge. I think what really happens is that women often become slower to get aroused, and it's, you know, when you're 16 years old, it's jump in the back of the car, wham bam, you've gone there. When you're 56, you know, it's going to take a bit longer.
So going to be a bottle of very good plonk and probably a very nice
So the idea that, you know, at 11 o'clock at night he's going to say how bad it and you're going to be rampant, that's not going to happen. It's probably not going to happen at 45 or 35. It's certainly not going to happen at 55. And foreplay isn't nibbling her earlobe or giving her a back rub. Foreplay is washing up the dishes together and having a laugh, or going for a walk, or working out something that you might wear when you go out to dinner the next night, and think about what undies you're going to wear.
I often call it planned spontaneity.
Oh,
Do you
yes.
think it works?
Well, forget spontaneity, because if
Planned
you wanted to be spontaneous, you may not have sex again for the rest of your life. Planned spontaneity, yes. And the planning is part of the foreplay, because you're thinking about it. It's become to the front of your mind. And the pressure also is not... You know, people seem to have this idea there's someone standing at the end of the bed holding up a card going 9.5, 8.2. If you're happy having sex once every 6 months and you love it and your partner's happy with that, that's a great sex life. It's not measured against how many times, how many positions, how many things you do. We live in a very ageist society where it's all focused on youth. What we're trying to do is maintain an physical intimacy and physical affection in a couple, or a sense of one's own being as a sexual being if you're alone, at the level that makes you feel happy and satisfied. It's not a competition.
I suppose one of the things that I'm hearing, I have this ability to hear beyond the scope of the other side of the computer, that someone is saying right now, yes, okay, I understand, but physically it's uncomfortable.
Well, there are physical things that you need to be aware of. I mean, some women do have problems with vaginal dryness, with pain on intercourse. A woman described it recently as though she's got sandpaper inside. With atrophy, so that maybe they can't have a penetration that's, you know, as big as it was before.
So on that one, can I just interrupt you, because I want to go and just quickly ask Liz. So the woman who's got the dry vagina due to the thinning of the wall, but doesn't, just sort of says, oh, I don't want to go near the HRT, do we have topical estrogens that they can take?
Yes, and the use of vaginal estrogens is very safe. There are creams and tablets available, and they work extremely well, and we use them in most patients. There are very few women who have a contraindication to
I would like to say too that it is never normal or acceptable for sex to be painful and to persevere. That is not, oh well, I'm getting older, it hurts, I grit my teeth and bear it. That's actually aversion therapy, and it's going to put you off having sex faster than anything else. So yeah, that's a really, you know, important thing to go and talk to someone if you are suffering from any symptoms that are making. But the other thing that I also want to encourage people to do, in the West, we consider sex to be genitals coming together. And I would encourage people as they get older to broaden also their notion of sex. There will be couples where, because the man, for example, may have had a prostate operation, he's not going to be able to get an erection. Penetrative sex of that kind isn't going to be possible, but that doesn't mean your sex life's over. And by being creative, by exploring a variety of things, you can get a wonderful, rich, intimate life and keep that going.
It's amazing what an ice block and a feather can do.
Absolutely. Well, I'm a big I'm very big on saying to people, have a look at some of the principles of Tantra.
Absolutely.
And I don't mean wear a saffron robe and say, oh, woman, sit in the lotus position, but the principle about, one of the basic fundamental principles with Tantra is the breathing, as you were saying. It's like that yoga breathing. A lot of people, when they're getting intimate, they get tense and they hold their breath. Just focusing on breathing, bringing the energy up through the whole body, enjoying all of the senses. So setting a mood. You know, you're not going to sit under lights like this and get naked at 60 and feel comfortable.
Absolutely not.
Light some candles, put on some music, maybe some scented candles. What you're wanting to do is engage all of your senses in pleasure and enjoyment. And so I actually think that as you get older, particularly for those who are in a relationship that is going well, this can actually be the beginning of a fantastic period in your life. The kids have grown up and left home. It's going to be maybe less often, it's going to be slower, it's going to be more gentle, but it can be far richer because you have shared so much that you could be now going into the most wonderful period of your life as far as your sex life goes.
So to maybe sort of almost say, well, look, let's throw everything out the window, start again, explore each other, start from scratch?
Yeah. Go and learn how to massage each other, but learn how to massage. There's nothing makes a woman more tense than the man who comes up at the end of the night and starts rubbing her shoulders. And it's like, oh no,
pinching her shoulder.
Oh no, that means he wants a sex. No, learn how to do it properly.
The number of men who say that to me, say, I was trying to give her a massage and she just tensed up and said that's because she knows what comes next.
Yeah, and if you're doing a full body massage, don't just focus on the nipples and the genitals. You know, go the whole body.
I know, indeed. Sorry, you wanted to say something?
I want to say that I think what I hear most from women is that they want to experience the giving and receiving of affection, and that's a very core part of a
Do you think men don't? Do you think
I think they both do.
Exactly, and I'm worried. I think this whole thing, and you said it too, about the ageing male and intimacy.
Yeah.
It's about intimacy, and that can be incredibly sexual.
Now, I have had a number of women who've said to me, we are dealing here with a male ego that can be incredibly fragile. And I've had women who said, I've been married for 40 years, had the most fantastic sex life. He lost erectile function and now he won't even hold my hand or give me a peck on the cheek.
Happens a lot.
Breaking through that and getting back to being friends and having fun together and being close. Don't pressure about the physical so much if that's what's happening. Just get, and also on both sides, reassure the other person that if I do hold your hand or I give you a kiss and you respond, that isn't a signal to me that we're going to then go on and have full intercourse. It's possible to have a flirty, sexy moment and then, you know, come in and out and move and drift like a dance. What freezes people is the thought that if I respond, I'm saying yes.
I know. I think you're right. Maybe and safe words are a good thing.
Can I make a comment? That don't we have to have some sort of social change where the idea that intercourse isn't the be-all and the end-all?
Yes.
And this is where I had a patient recently, and she has the vaginal dryness. She has some shrinking of her vaginal entrance, so that intercourse is so painful, and in fact the skin splits. And I said, well, you know, what about other ways of having sex and enjoying themselves? I didn't go quite into the same as what you were saying. And she said, my husband sees intercourse as intimacy.
And
So he doesn't see anything else as being intimate, but intercourse.
And there is a truism that says that men need sex to feel loved and women need to feel loved to have sex, and that can sometimes make a mixed match.
But
And
we have
for
to
men
remember
who
that stereotypes are harmful.
Oh,
And I don't
exactly.
believe that this is always
It isn't always the
true.
case, but it can be the case. And I think, as Liz says, opening up the conversation and getting people talking about this and questioning things and challenging assumptions and stereotypes is what's important, because unfortunately with the sex issue it so often happens between closed doors, behind closed doors. People used to come to me when I had the shop and say, look, this is the first time I've found somewhere I feel comfortable to talk about this. I can't talk to my mum, I can't talk to my friends. They don't know who to talk to, they don't know where to get information from. And if all the men, look, the thing is, if you see a group of men together at the pub, they would all be carrying on as though, you know, they're raging stallions. My husband finds this, he drinks at an Italian coffee shop. If you hear them as a group, they're all raging stallions. If you talk to them one-on-one, they're talking about their erectile dysfunction. You know, so a little bit of honesty and communication would be really useful too.
And gentleness.
I think that honesty between couples, as you say, I think often people are going to bed and clinging onto the edge of the bed and thinking, I just hope they don't touch me, I just hope they don't touch me, they don't want to comment. And the big one I'm hearing from women is, I'm finding it more difficult to orgasm, it's taking a lot longer, and he feels like a failure.
Yes, yes, and I think talking about it can look. You can have been married or together for 50 years and still find it embarrassing to have a conversation about sex,
And have it now, everyone.
and to have a clear conversation where the other person isn't hearing it as a criticism.
Well, this is it.
How do you talk about it? Often not in the bedroom would be a good thing.
Absolutely.
Pick a time when you're getting on really well
On the bus.
and you're having a great time, and start chatting.
You know, I'm just thinking about owning your own sexuality, owning your own sexual pleasure. I think there are a lot of women who have maybe grown up in an era where they think it's his duty, come on, give me the orgasm, love. And I think that maybe we need to turn around and own our own sexuality.
I think so. And I think also this is another thing, is that the whole subject of masturbation has always been taboo, and there are a lot of women who are incredibly uptight, and men, about anyone knowing that they do or that they will. I think it's important for a woman to explore her own body and understand what gives her pleasure so she can guide her partner. If she's lying back there, as you say, saying, you are not pleasuring me, he wasn't given a handbook.
He'll do a little shrinky thing if she says that.
That's right. And the other thing is this idea of being slow to become aroused. One thing I've also discovered with older women is practicing getting aroused on your own without it leading to intercourse. In other words, read some erotic fiction. Have a bubble bath, read some erotic fiction. Become aroused. It's getting the blood flowing to the area.
Exactly.
It's getting your body used to that response, so that when you are in a situation with your partner, you're already a little bit, it's like priming the pump. Keeping a
Couple of AA batteries,
base
and
level.
any AA batteries sort of appliances that you may have in
And
yourselves.
look, have a vibrator. There is absolutely, some people that call them marital aids as though they're a crutch.
Aren't you a relationship enhancement boutique?
That's right, that's right. I call them pleasure enhancing toys. But again, if women are slow to get aroused and are getting tense about that idea of, oh dear, if I don't have an orgasm, he'll be often a little tiny discreet vibrator that she uses during lovemaking that speeds the process up can just be a wonderful...
And I think I need to know a little advice to gents. If you are going looking for these relationship enhancement appliances, please, size doesn't enhance.
No, it's not about
it's
size.
Not about size.
And it doesn't have to be physiologically realistic.
The little vibrating sort of bullety
butterflies
things.
and
I
things.
love those as well.
That's
Did I say
right.
that?
That's right.
I think you know what you're saying. I think is great that people need to build the intimacy, and I tend to say that the F word, fun, seems to have gone out of people's
fun.
lives.
And look, the thing is too, for those people who need medical permission to have sex, and there are some people who seem to need medical permission to allow themselves for various shame reasons or whatever.
You've got
Statistics do seem to show that elderly people who maintain some sort of physical intimacy have stronger immune systems, they suffer less from depression, and they have a better quality of old age.
Now, I had a question now, yes, from Monica, and what Monica wants to ask is, are there any changes in her diet that will help with lubrication? Who wants to answer this one?
I can answer that.
Thank you.
For some women, there was a research paper that showed that having 2 dessert spoons of linseeds. Now these are the seeds.
Linseed.
That's it.
Have your cactus
That's
oil
right.
here?
Not the oil, but the linseeds themselves, which
But they've got to
contain
be
these phytoestrogens.
freshly ground.
Excuse me, what's it going to mean at the checkout when price on linseed oil in aisle 3, please?
Not the linseed oil, because it doesn't contain the phytoestrogen. So the linseeds themselves, and freshly grind them, because they do contain good essential fatty acids, and once they're ground they'll start to oxidise or go off. And also some women will find just having more of the soy in their diet, like tofu or soybeans.
Now, what we're going to do now is going to your questions. We'd love you to bring us up. Oh God, I'm still on the radio. Here we go. To write down your questions, send them to us. We'd love to hear your questions. We have a few, but before we go to the questions, Jane, I just wanted to come back to you because you have 7 points that I'd like you to elaborate.
I do. I thought you made a very good point before about saying people need to take responsibility for their sexuality and sexual confidence, and I think the same applies to mental health and emotional well-being. And there are really 7 dimensions of our lives that are important. First of all, it's very important to think about the quality of our relationships, as we've been talking about. And the thing that really most detracts from mental health is to feel criticised or intimidated by people. The next one is really to have daily opportunities to experience a sense of satisfaction or achievement. And people get this in very diverse ways, sometimes from simple things, sometimes from completing bigger tasks. But people with good mental health are able to say what it is that has gratified or satisfied them that day. Thinking about personal safety is incredibly important, and if you feel frightened or intimidated by someone near you, or frightened in your neighbourhood, or unable to assert yourself at work, this is bad for mental health. And in general, the healthiest women are those who are able to be healthily assertive and not to feel intimidated. Good physical health, as we've already heard a lot, is closely linked to good mental health. It's very important to be well aware of your own financial situation and not to place yourself in a situation where someone else is making financial decisions on your behalf.
I was just going to say, it's I think one of the patients just look at me and sort of say, what are you talking about? When I say to them, the thing that will fix your mental health problems the best is get a financial advisor.
Exactly, but for women also not to assign that to somebody else. So really to be well informed themselves. And one of the last important ones is community connection. So to be involved in something that is a purposeful but shared activity with others. And in general, people who can have all these dimensions to their lives have much better mental health, including at midlife.
Absolutely. I'd like to go to some questions now, if you're happy to open the wait. And one of the big ones, and this is from Vanessa from Sydney, is do I need contraception during menopause? Now, I suppose this is a really technical question if you think about it, because by definition, does she need it in menopause?
So the definition of menopause means the final menstrual period, but you don't know that you've had your final menstrual period until you're 12 months after it. So yes, women should be using contraception if they don't want to get pregnant, even though the chances are very low. If they're over 50, for 12 months after the final menstrual period, and for women who...
How do they know if they're on
contraception?
contraception?
They just got to keep...
If they're already on the contraception.
But that depends on what contraception they're using.
Okay, sorry. If they're on contraception and they're having their monthly withdrawal bleed, so they go on the sugar tablets for a week.
You're talking about oral contraception.
Oral contraception.
What about other forms of contraception?
Sorry, I jumped. If a woman is using oral contraception...
That's tricky. That's a very tricky question.
When should she stop?
When should she stop? It's an answer that nobody can give you. There is no literature to suggest at what age you should cease it. But obviously, if women are on the pill in the perimenopause, they should be non-smokers, not have any heart disease, high blood pressure, diabetes, all those things.
And I think women need to understand the risk of being on the pill and the increased risk of stroke. And any woman who smokes on the pill over 35, I don't know where she's getting it from because I don't know any doctors who will prescribe it. And that is a worry. It's a real risk.
So the answer is that contraception should be used until 12 months after the final menstrual period. However, if they are on the pill, they say whoever they are, suggest about 50, but in fact it really depends on the individual woman what...
and can you make a change from using the oral contraceptive pill straight on to HRT? At what?
Sure.
I mean, you can make it, but you can't go on HRT if you're still menstruating?
Well, you can go on HRT if you're menstruating still, but you go on cyclical therapy, but it's not contraceptive.
Ah, that's a very good point. So if you are still cycling, you're better off on
if you've got hot flushes and sweats and different symptoms that might be improved by being on hormone therapy, you're going to use it cyclically so you have a monthly bleed, but it is not contraceptive if you need contraception. So then it has to be looked at as to what...
So if you are still actively having unprotected heterosexual sex and you have not yet had 12 months since your last period and you want to take hormones, you actually should be taking the contraceptive agent. Yeah.
Or you could use a Mirena IUD.
Oh yeah.
That would be suitable.
Is that going to help your flushes if you're getting them?
No, it's not, because it's a progestin, so it's like a progesterone.
It hasn't got the estrogen.
Hasn't got the estrogen. So, but you can add some estrogen. So then you would be okay.
What about adding testosterone? We haven't talked about testosterone.
Testosterone's a tricky question. And the answer is that there is no product approved of in Australia by the TGA. And there is no absolute definition of a testosterone deficiency disorder in women.
Well, we haven't even got it in men, to be frank. They don't know the normal net levels of testosterone in men. So
measuring testosterone levels are tricky in women because we're looking at small levels. However, the women who do need or perhaps should be considered for testosterone are those women who have their ovaries out before their menopause.
We have a question from Lisa from Fitzroy Crossing. She says, I don't feel like being intimate with my partner and it's affecting our relationship. How can I change the way I feel? Maybe Maureen.
Well, I think initially, as we were saying before, forget about the sex to start with, but work on the relationship and just start having some fun times together, because you know, going out to the cinema together, going out to the pub together, having dinner, just doing things you enjoy, having a laugh. What you have to do is rebuild goodwill.
Can I just interrupt and say this lady's from Fitzroy Crossing?
So she's not going to...
All right, so she's not going to be going to the cinema or the
What
pub.
about internet relationships? What about on the internet? Sort of, no, hang on, she wants to have a relationship with a partner.
She wants to have fun with her husband. That might make her feel a lot happier, but I don't think it'll help him. No, I just think that the focus has to be that take the one step back from the sex, rebuild the relationship and get the goodwill there, and then move forward.
You know what they can do? Maybe get a mail order salsa dancing DVD and learn, because salsa dancing brings you together and it's pretty sexy. And as you say, it's about having fun.
Yeah, or get a sensual massage tape, and sensual massage teaches you all the normal massage and then massage the bits as well at the end.
But
so
I think we can't forget that loss of intimacy is often about loss of trust.
Yes, and she may think if I do this, we're going to end up in bed.
Well, there may be other things that have taken place that have caused her to feel less trusting, less affectionate towards him. And while these other suggestions are very good ones, I don't think we should neglect this other potential.
And I would also say...
Absolutely. And resentment over the years can be a terrible killer.
Exactly.
So they need, you know, maybe... I was speaking to a woman who's a relationships counsellor, and she said one of the things she thinks is very sad is the way that people use that as a last resort rather than a first resort. Because by the time people come to her, the problems are so entrenched, it's really difficult. When you start to find you're not communicating, when you find that you're drifting apart, that's the time to consider maybe seeing somebody a couple of times just to get a little bit of guidance on how to fight fair, how to talk properly,
how to listen well,
active listening. Just a few skills to help them to communicate.
You know, the other big one that we haven't mentioned is how we feel about ourselves. You know, we look in the mirror and we think, well, I didn't used to look like that.
Well, body image is a really big one. And women, as I said before, we're in a youth-centred society and we only see images of young people. And if we see images of old people making out on telly, people go yuck, and you know, so some women feel almost embarrassed about their bodies.
And I think a lot of women are sort of saying too, when their husband or their partner, or whether male or female, their partner says, you look gorgeous, they go, you're just saying that because you want sex.
That is something too that I think it would be great if people could believe, men and women, if they get a compliment, try to take it graciously. And don't say, but you haven't looked at this cellulite. Don't point out the bits. Actually, be a little bit gracious and say, yes, thank you. And look, there's an analogy that I use, which is perhaps not flattering, but men love looking at Ferraris and Lamborghinis, but they also love their own Toyota Hilux. And
we are their Toyota Hilux.
Exactly.
I love it. We got a question from Liz from Mildura. She says, I'm divorced and I'm currently not in a relationship. How do I deal with feeling a bit empty now that my kids have left home? I think that's you, Jane.
It is, and look, it's very understandable, and this is a predicament women can find themselves in.
We're useless? Is it we've lost our
I think we're
purpose?
lonely. We're lonely, and I think it's very understandable that she feels that, but one of the most crucial things to do is to take active steps towards restoring some of the connections that you experience when you have a busy household with children in it. One of the very beneficial things women can do in this kind of situation is to get involved in voluntary groups or community groups. Also, if she's been divorced, she might well feel a bit mistrustful of establishing a new intimate relationship, but it's important to know that it's never too late. You can always learn something about what went awry the first time to try to ensure that the next time you establish an intimate relationship, it might be different.
The other thing that I think we haven't covered is the issue of carers and the issue of when your partner becomes sick and you then have to adjust to being their carer rather than their partner.
Well, I think the more common problem, I quite agree with you about that for women in midlife, is that their parents become sick and they move from the phase of life with major caregiving responsibilities for dependent children quite rapidly into caregiving for frail elderly parents. And still stereotypically, not exclusively, women pick up most of this burden. And it's obviously people prefer to older people prefer to continue to live in their own homes, and usually they're unable to do that because female family members do this
and I think
caregiving.
Women need to know about the sort of resources that or men who are
Absolutely.
carers, that there are resources out there, and
Absolutely.
and you really can find them, and I'm sure we'll put some of them up on Jean Hales.
And that we're not saying don't do it, but if you do it, you're more likely to be able to continue it if you attend to the other things as well.
Absolutely.
So don't give up your job, don't give up singing in your choir, don't give up having dinner with your pals. It's really important
And don't
that you
always
do those
put
things.
yourself last.
Yes.
Oh,
Yeah.
hallelujah.
Make yourself the priority sometimes. Don't feel guilty about treating
Well,
yourself.
you're much more likely to keep being able to do these other things graciously, as you say, with good humour, if your needs have been met.
Some women or people have internalised the idea that self-care is selfishness, and there is a big difference.
That's right.
We have a question that I think is very, very interesting, and I think it's actually for me. And that is from Tracy from St Albans. What about STI risk post-menopause? Is this still a risk? Well, Tracy, it depends if you're having sex. If you're not having sex, an STI risk isn't there. But if you are having sex and it's unprotected, you are at risk. And that's what worries me. That I think a lot of people sort of think, oh, STIs, that's something that happens to young people. Tracy, watch out.
Well, the
Condoms,
growth
condoms,
group,
condoms.
the growth
condoms,
group is
condoms,
older women.
Absolutely.
Because we often missed, we were often in a relationship when the whole condom revolution happened.
Absolutely.
We treated condoms as contraceptive, not as protection from STIs, and we're not used to the conversation of how you negotiated. And if we are socialising with older men with irregular erections, they are very condom resistant because by the time they've got the packet open, the need for it is long gone.
And that's where you've got to use it in foreplay.
yes.
Start using it.
Learn
Now-
how to put it on with your mouth.
Yeah, that's here you go, Tracy from St Albans. There's something for you to do this weekend. Comment from Kathy from Sejuna. I see products on my pharmacy shelves that claim to help the menopause, yet I know that you should see a qualified naturopath. What's the difference between products on the shelf and what a naturopath would give me? That's for you,
That's me.
Sandra.
There's several points I want to make about that. First of all, do you know what you're treating? So, you know, where did you get your diagnosis from? You know, a hot flush might be a hot flush, but it might be something else. You know, is it Dr. Google or has it had a proper... Dr. Google plays a big part.
Do you mind if I just I'm sorry to interrupt, but that point is really important, and I'm sure Liz you would
Generally.
agree. No, but the thing is that there are some malignancies and blood malignancies that can present as hot flushes.
Yes.
And what worries me is that women just make a natural assumption, and it probably is menopause.
Yes.
But but get it diagnosed. Would you agree?
Absolutely.
Sorry, Sandra.
That's okay. And look, and then there's the whole issue around getting the proper diagnosis, and then there's this belief that because they're natural therapies that anyone's an expert. And I know that there is a lot of misinformation around natural therapies. The products that are referred to on the pharmacy, a couple of things with that. Often I pick up a formula and it has every single herb or vitamin that has some sort of estrogen-like activity all put in the one container, often in sub-therapeutic doses. So the dose isn't actually going to be effective. Now, sometimes it'll work, you know, you can give it a go, and I know some women in rural communities or that don't have access to a naturopath are going to try this, but it is kind of taking a bit of a gamble.
Just talking about that,
Placebo.
people,
And placebo
well,
can play a part.
and I was just thinking with the growth of online shopping, what worries me about
Yes.
people are going to buy things from overseas
Yes,
where
and
they
I
don't
think-
have
No,
the same.
the regulation.
They don't. And look, people think that because they're from the States, they're better. In fact, Australian quality herbs are generally much higher quality. And look, particularly with herbs, there's a real issue around quality. Generally, what you would get from a practitioner generally is going to be a higher quality than what you'll get over the counter, and particularly, you know, compared to overseas.
And just some other countries where you may import these
Yes.
things from have no regulation, and you could have all sorts of stuff in there and just don't go there. Comment from Leanne, a woman after my own heart. I've put on 15 kilograms since the hot flushes started 12 months ago. Is menopause causing it, Liz?
It's a very interesting question, and we know that metabolism changes, and so we in fact change our body shape. There's some literature recently published that suggests that in fact we don't put on weight due to the menopausal change. We just change our body shape.
Actually, it's interesting. Women say, it's this bit.
Yeah, we've
the
all
spare-
got this
Why
bit.
don't we actually embrace that? Why is it that if that is part of every woman's ageing process, why don't we start saying, spare tyre, love the Michelin?
We all need to wear saris because they show
and
off
don't
their,
they look, yes,
they
maybe
show
we
off
should
their
start
bulgy bits.
embracing. I know what, Maureen? Belly dancing.
Oh, belly dance. You can't belly dance if you're scrawny. Well, you can, but it doesn't do anything. You've got to have a belly-to-belly dance.
But the other thing that worries me, I'm seeing a lot in my general practice of women at menopause also developing thyroid disorders.
Exactly.
And it's certainly, if
Have
you're
to
putting
be
on weight, worth
detected.
getting your thyroid checked.
I think every woman, if they have symptoms around the time of menopause, should have their
So,
thyroid.
so the sort of things, if you
So,
think...
I mean, the other thing is that metabolism does slow.
Can I turn it around also, though, that women shouldn't beat themselves up if they can't maintain that size 10 figure that they had when they were 16, that it might be that with this change of body shape, they're not going to fit into those little skinny jeans that they used to, and that by beating themselves up and trying to do that, that's possibly not very helpful.
I've got them
either.
in the top cupboard.
And you just don't look at the size of... Ask the sales assistant to bring you something in your size. Don't read the size, try it on and then decide. Because we used to freak out when we see the size.
If it's available, Sally, and
Yep.
we need to
And
be
we need to
lobbying
address that too,
for
totally for plus size, and there are some fantastic
Yes.
stores now. I agree entirely. Personally, I've just lost 25 kilos. I have been there, do understand it, and I think that we need to lobby for fashionable good clothes. I think we're getting there. Now, here's from Teresa. I sometimes get very strong palpitations with my hot flushes. Is there a danger to my heart in the long term? Do you want because I'd like to answer that from a general practice perspective.
Would you like to answer that?
Yeah, I actually would. Look, and I think, Teresa, again, what we've got here is if these are just strong palpitations with your hot flushes, no, they're not going to cause a problem. But we need to get them diagnosed. Because the trouble is, palpitations may be something that is important. It could be a problem with your heart. It may not be. So you can do something like a Holter monitor, which is to have a test over a 24-hour or even a whole 7-day period, where they do a little ECG and see what these palpitations are. So don't self-diagnose, I suppose, would be the message.
Well,
there.
I think the important thing is that, yes, with a severe hot flush, you can get palpitations, that is a normal response to a severe hot flush. But I agree with you, it has to be excluded, that it's different.
And it won't damage your heart, those palpitations. No. Does your temperature actually go up during a hot flush? Or is it just you feel that way?
No, your facial temperature goes up a number of degrees.
What about heart disease and diabetes around menopause? Is there anything about that, Liz?
Well, when we go through when we've had our menopause, I should say, we know that cholesterol levels will go up. That's a natural response to the lack of estrogen. So that obviously there's an increasing risk as we age of heart disease and cardiovascular risk. I think the major risks that we have in our society are the problems of being overweight.
I'd like to put in a little plug here, I think, for the Heart Foundation, who have their Go Red for Women, and the biggest thing they're saying is women forget that after menopause we approach the same risk as men. And we all think about getting our blokes down there to get their cholesterol and blood pressure done. After menopause, we are as at risk as they are.
Well, if a woman has a heart attack, she's more likely to die than if a man does.
Yes, that's right.
This is a clincher. Now, Helen has got. I'm so pleased she's brought that up. Thank you, Helen. Can you comment on our vitamin D levels and the relationship between this and health? I've heard there's a connection with breast cancer risk. And can I just say, as a general practitioner, Helen, I think we're all very confused about vitamin D levels. I don't personally believe that everybody in the community can be low in vitamin D, which is what these tests are doing. I think we have to go back and relook at them. Liz, have you got some thoughts?
I mean, nearly everybody seems to have a low vitamin D level when you test them, and obviously they go down in winter. I mean, there is some suggestion that there are major health risks with low vitamin D, but I don't think we've got it absolutely.
The trouble is we're sort of locked into treating it at the moment because that's what's going on, but I don't know that the research is there.
I think the important thing about vitamin D in the postmenopause is that it is linked to osteoporosis,
Yes.
and that if you have persistent low vitamin D, then you're at greater risk of osteoporosis.
Can I make a comment about vitamin D? Because certainly from a naturopathic point of view, certainly with the osteoporosis, there was a meta-analysis now that's looked at several 100,000 people, and having vitamin D levels adequately over about supplementing with 800 international units a day decreases the risk of hip fracture, absolutely. But look, it is also one, I think, that can be looked at. Sometimes low vitamin D can be misdiagnosed as things like fibromyalgia, and there is some association with certain cancers having lower levels, but it's still a bit of a grey area.
And it's not necessarily cause and effect. We don't know what the risk ratio there is. We're going to move on in a moment, but just on that one, Liz, can I just ask you, does HRT protect against osteoporosis?
Yes, HRT prevents osteoporosis, or can prevent, and it is also a treatment for osteoporosis in women under the age of 60.
And is it enough, or do you need to do the vitamin D, or only if it's low, and the calcium?
I think you can comment more about this than I can really, but I think adequate calcium and vitamin D in a diet or with supplementation is quite necessary.
But women forget to take their calcium. That's the thing. It has been shown to be useful, but they forget to take their calcium.
So we should have calcium foods if we can.
Being milk, dairy.
And sardines.
And sardines. I love sardines. Sardines are the thing. Now, I have a final question.
Sorry, I was going to say vitamin D foods. We always talk about supplements.
Yes, they're quite low in foods, though.
Is it hard to get
sunshine?
Fish, I know it's sunshine, but I often think about cultures where women are veiled or are kept in the house all the time. Surely those cultures aren't all, fading away with vitamin D.
They are.
They are. Right, okay.
Now, I've got a final comment from Louise in Oakley. Was a question. She's just asked this: soy and breast cancer? Question mark.
Good research. There's been a lot of misconception around soy and breast cancer based on the fact that they think estrogen in these plants causes breast cancer. There's been a meta-analysis that looks at all the research, and several points have come out. Overall, if women have a diet high in soy phytoestrogens, it tends to lower the risk of breast cancer, especially if it started before puberty. The protective effects are before puberty. If women who have had breast cancer and are survivors of breast cancer continue to eat soy in the amounts consistent with an Asian diet, there's no increased risk of recurrence, and in fact Asian women who continue to eat a diet high in soy have a better prognosis. What the caution is these highly processed supplements of soy. We've taken bits of the soy and made it into a tablet. We can't say that that has the same safety and efficacy as having whole soy.
Thanks very much for all of your questions. They've been great, and I really want to sort of have a little bit of a discussion with you all now on something I think is crucial for not only women but men but everybody, which is where the hell do you get good information from? So who would like to start this ball rolling from their perspective?
I think you have to. I think women have to and men have to really source good websites. I think it's so dangerous to go Google menopause.
And that's where Jean House, you can use Jean House as a bit of a conduit, I suppose, a bit of a gateway.
I think I did a little bit of my own Google and looked at menopause and myths, and one of the first websites that came up, I looked at the information, and it was very convincing, but at least half of the facts would not be what I would agree with. And so unfortunately, particularly with natural therapies, there is a lot of misinformation. Our website is a good start, and we do have a summary on a lot of the natural therapies and some in greater detail.
I suppose people are going to expect us to say, hey, go to the Jean House website. But
I think there's more.
Can I just, before you say that, but I was going to say one of the reasons why I personally would say Jean House is because we don't take a Western or a naturopathic view. It is a holistic view. But sorry, Jane.
Well, I think one of the things you've both referred to is the difficulty in discerning whether it's drawn from a good evidence base or whether it's someone's opinion. And I think it's always important to look at the credentials of the source. It's much better if the information is from a well-recognised institution or group. But people actually don't always get information from the internet. No. Many people read. Most people actually get information from family and friends. And that can be the difficult thing, is you can pick up anecdotes, but those don't always apply to the whole population. So I think the very important thing is to get high quality information from diverse sources and ensure that if there are inconsistencies in it, you're discerning about what those might be.
So read widely and wisely.
Talk, ask, listen.
And Maureen, obviously the trouble with with looking up things about sex when you put them into Google is some things come up that you don't really want to come up. So any advice on how to get good, reliable information?
Look, there are some fantastic books available, and I think probably you're going to be safer than Googling sex. Well, you might have a great time if you Google sex, but I would say look at the books. And again, organisations like Jean Hales have got fantastic book lists. So again, if it's a well-renowned writer who's got a good reputation, read. One book that I can highly recommend by a doctor from WA, Dr. Vivienne Cass. It's called The Elusive Orgasm, and that's a very good book for women who just find that that's something that they.
Can I ask your opinion about Betty Dodson's book? Do you know Betty Dodson's
Betty
book?
Dodson's book, Sex for One, The Art of Self-Loving, is the most wonderful book for someone who's alone. That is a book that really debunks all the taboos about masturbation,
She's
and
an
it is
amazing
fabulous.
woman.
And she
the
redid her DVD at about 60, and she's still absolutely out there.
So it's worth Googling her, Betty Dodson.
She's fabulous.
Self-loving for one. She's in New York, I think, and she still runs these master classes. So if you're looking for something to do, girls, go over there, get your Louboutins and get your, Sex in the City and your. But no, she's a phenomenon.
And another person for when I was talking about broadening things out, Barbara Carellis has a book called Urban Tantra, and what she's done is taken the principles of Tantra and applied them to a modern Western lifestyle.
Well, I think a lot of people are worried, as you said about the saffron rose. I think if I go to Tantra, are we going to, like, they're trying to convince their trucky husband, will we go on
Forget Sting.
Yeah, okay.
It's nice to look at that.
I have a final question from Lindsay from South Yarra. This is magnificent. Lindsay, love your work. What is the best way to support someone going through menopause? My mum started to get rather moody and cranky. Isn't Lindsay divine? Ladies, what would we say to Lindsay?
Let her get some sleep.
Wash the dishes, Lindsay.
Some sleep's good, but remind your mother she has a long life ahead. Get her to begin thinking about what it is she still wants to do, rather than feeling there's nothing left to anticipate
Lindsay,
with pleasure.
And Lindsay, don't say, Mum, have you taken your HRT today?
That's right. Be a little bit patient. And there is a Facebook site called My Mum's Going Through Menopause, so there is a support group there for teens.
Gotta love it. Now I'm going to ask you to give us each a message that you, because we're coming up to the end of the show, and I'd love you to give us a message each. We'll start with you, Liz. A message for take home for a woman watching right now.
Well, I think my message from the gynecological point of view has to be about hormone replacement therapy because of the 10 years of misinformation that we've had. If you're a fit and healthy woman having menopausal symptoms that are impacting on your quality of life and you don't have any major risk factors, then hormone replacement therapy is safe for you.
Sandra?
I'm going to look at diet because it doesn't have to be all about what you take or what you don't take, and I want everyone to have a look at what they're having for breakfast. Are you having breakfast? And build on that breakfast. I've given 5 tips. You can easily incorporate the prunes and the yogurt and the linseeds to a muesli, or don't just walk out the door with jam on toast. Really look at breakfast, have a good breakfast and build on that.
I want women to really regard this as one of the most exciting and optimistic phases of life. That this is a phase of life when you can really pursue ambitions and goals you haven't been able to pursue before. And one of the most productive phases of life is the postmenopausal phase of life.
Absolutely, because you write and you can just take it on and no one can tell you you're not.
You can, exactly.
Maureen?
Well, I would just like to encourage women to not feel as though they're coming to the end of their lives as sexual beings, but to broaden out what that means. And to, again, embrace the fact that this is the beginning of the second half of your life and this is going to be a great time, so enjoy it in all its facets, including sensuality.
And I think that, have we got a message for the men? Have we got anything that we can say to the blokes who are watching now?
Get the breakfast ready for the
get the breakfast ready
take it into bed.
Yogurt, prune
I
juice.
think what about the Hoover can be a very sensual marital aid?
Yes.
Not
Housework
not
is
what you're thinking, housework.
Housework is an aphrodisiac.
Housework
Be patient and be prepared to let the person say, let's stop.
And what about the fact that maybe as women, if our husbands are often afraid to tell us that we're not dealing with it or we're not coping, maybe we need to actually accept what they're saying and...
But I think also in relationships like this lady I was talking about, she's feeling absolutely terrible that she can't have vaginal penetration. And so I think
we need to talk about it.
We need, the process of getting older does have these issues, and I think we also have to be realistic about it.
Oh, absolutely. But that's why I mean broaden out what you mean by intimacy.
Yes.
And
it
intimate
doesn't mean
pleasure.
she loves him less.
Exactly.
No, absolutely.
There are
And it doesn't
plenty of
mean he's
ways-
less sexy
or less
she's
lovable.
less sexy or less
Exactly.
lovable. And I think, though, that we all need to just realise that whatever you feel like, whatever floats your boat, and that is, if you do want to have sex, go and talk to someone about how you can improve it. You know, there's, as Maureen said, or talk to your doctor. If you don't want to have sex, well, talk about that too.
I think that that women should embrace the postmenopausal years.
Absolutely.
We
Because
get funny glasses and strange asymmetry.
and strange, that's right.
And we don't put up with nonsense.
We
And
don't.
I think
No.
that's one of the most
I
important
think
things
that's,
in
and
midlife.
I think that does destabilise. Perhaps that's what
The people
Lindsay's,
around us.
perhaps that's what
Exactly.
Lindsay's talking
Yeah,
about. In
yeah.
fact, that Mum said, "Oh, I'm so fed up with all this. I'm not going to listen to
Do
this crap
anymore."
anymore.
Yeah.
I'm not listening." So she's cranky.
But
etc.
also, we need to find out how old Lindsay is. Maybe she's actually like a teenager going through her
She
own
could be, yeah,
hormonal upheaval and
Exactly.
then sort of just dumping it on
exactly,
Mum.
exactly.
You know, that often is happening.
Well,
when
that's what
you've
you're
got-
saying earlier about these things that all happen at once, the life stages. I mean, everybody's going through problems. And maybe that's what we need to sit down and discuss. That, hang on, we've all got problems. We've all got to
Exactly.
get through this. How are we going to do it?
And older women often say they feel invisible, that they become invisible.
Yes.
But they've actually got so much to offer the world.
And one of the ways is to, as you pointed out, get involved with community groups. There are some stunning. In fact, I see what's sitting beside you there, Liz. I think you should bring it out. You know, Liz
Liz
is one
is
of the most
knitting.
creative women in the whole world. She bought her knitting, ladies and gentlemen. What are you knitting at the moment, Liz?
This is, well, I'm just experimenting with this alpaca wool to knit a scarf for a lady overseas who's going to be coming up for winter. So I thought I'd...
And you know, this is the whole thing. And there's quilting groups, or if you don't like that, there's art groups. Or if you're into sport, take something new up. Try something new.
Or take up
And
belly
can I-
dancing.
Yes.
Take
And
up
don't-
something a bit out there. Don't wear beige every day.
Ooh,
Be
black.
brave
Don't
enough.
wear black.
Be brave
Hello?
enough to wear some bright
Your
colours.
mother's wearing black. You've got grey and white. It is grey and white, ladies and gentlemen. It's not black.
Don't retire.
Don't
retire.
Or if you, no, don't retire. You might want to change jobs.
Yes.
Find
Or
a
you might
new
want to
career.
alter your hours. But
always have
yeah.
a career,
Exactly.
no matter
And
what it
if
is.
your husband's retiring, find a career.
Yeah.
It's time. But the thing is, and you know, and I know a lot of people who are carers often say to me, it's the same sort of thing. They've been a carer all their life, and all of a sudden they're not. They say, "Oh, I'm useless." Hello, you're probably, and this is again with women, you're probably extraordinarily organised, wonderful at finances and organising the house. Although sometimes we have a problem. But the thing is, think about the skills you've got and start applying them.
But I think women should actually look at the things they've always said, "Oh, if only I could do this, if
Stand for
only I could
Parliament.
do that."
Yes, and
Stand
the
for
time
Parliament.
And
There you go.
actually go and do them and
I
say,
was
"This is
telling
my time."
colleagues earlier, my 86-year-old mother-in-law, who I hope is still listening, enrolled for a master's degree.
Oh,
fantastic.
Fabulous. Fabulous.
That's what we all should be doing.
Absolutely.
And we've had a couple of questions about memory and reduced cognition. The best way to prevent that is remain engaged in
Well,
intellectually
can I tell you, it is
challenging
my,
activities.
It is my Auntie Peg's 90th birthday
Yeah.
today on Halloween, and she's organised her birthday party next weekend. Organised it all herself, but I've given her a birthday present. You know what it is? Balloon ride over Melbourne. I mean, do things you've never done.
Yes, that's right.
It's time for adventure. Go on that European trek in the backpackers. Why don't we? Okay, here's the challenge. Why don't we start taking over the backpackers? Out you go, young kids. Let's have the silvertail ones. I think it'd be
Grow old disgracefully.
Absolutely, absolutely. Look, it's been absolutely wonderful having you guys here, and it's been wonderful having all of you too, I have to say. And I've got to say thank you all for taking part in this. You have been absolutely wonderful people. Especially thank you to our fabulous panel, to Liz and to Sandra and to Jane and to Maureen. You've been magnificent. It's been lots of fun. We hope you have enjoyed our webcast. We have certainly enjoyed having you with us, and we've been enjoying being in your computer all night. So it's goodbye from Jean Hales, and thank you so much for being part of 50 Shades of Midlife, Menopause, Mood and more.